What's the best lip filler technique to avoid lumps and get the best possible results? If you're not already massaging lips properly, you're probably causing yourself a whole load of unnecessary work. You'll have patients coming back who actually don't need to come back. You'll be blocking consultation time for people who really should be at home enjoying their new lips. And you may even think you're a bad injector when you're actually really good. These are just some of the problems that come from not doing a good post-procedure massage. And in this video, we're going to cover everything you need to know about how to do this in a seamless, excellent way that gets you way better results and saves you loads of time in your clinic. So why would you need to massage lip filler? Well, even with the best injection, there are always going to be high pressure spots. So as you're injecting, the tissue will hold on to filler in some places or it'll spread more easily in other places. And this forms small irregularities in the tissue. This is even worse of a problem if you are using larger volumes or injecting larger boluses, where the tissue will naturally hold on to filler in some places and it will spread or ooze in different positions, causing irregular outcomes that aren't that apparent until you feel the lip. One of the common concerns with massaging is maybe it will move the filler in a place where we don't want it to go. And this indeed is the case. You can absolutely ruin a good procedure by massaging in the wrong way. So we need to do something I call smoothing it without moving it. And this is the technique which I will show you later in this video, which enables you to effectively add an additional level of sculpting to your procedures rather than just blurring all the injections that you've put in the correct way. So in this matter, technique is everything. But how hard should you massage dermal filler? I use the analogy of imagining that you are looking for a pea in the dark on a plate. Imagine you just had to squash a pea. So you would feel around first, find that pea, and as you find the center of it, you would gradually increase the pressure until it popped. It's a little bit like that with dermal filler. So it's this honing in on where the imperfections are, narrowing in until you have the pulp of your finger right over the bit that you want to blend in, and then gradually increasing the pressure while sensing what's happening with your fingertips, and then allowing that to guide your movements until it's blended in. So how long should you massage lips for? Really isn't about the length of time, it's about the result that you're aiming for. So I would squeeze and massage the lip until it formed the shape and I got rid of the imperfection that I could feel. That is usually quite quick. I would say if you're spending more than 30 seconds, you're probably overdoing it. And it really does depend a little bit on how good you are at sensing the changes you're trying to create with your fingertips while you're massaging. So what happens if you massage a lump and it doesn't go away? There are actually a number of common reasons for this, but probably the most common is that you're just not doing it hard enough. Many over-empathic injectors will struggle to put the full strength into their fingertips to actually blend in a lump until they have a bit more experience. And in these cases, all you need to do is try squeezing a little bit harder. But if you've already done that and the lump is still persisting, there are some other common reasons that you also need to know about. The one is pre-existing lumps. You will occasionally meet patients, sometimes to do with past dermal filler treatments, but often it's something else. So a little bit of scar tissue or from an injury from many years ago, some sort of imperfection in the lip that you are already feeling. That can potentially cause a lump that you cannot massage. And sometimes the procedure itself will cause a bruise or a hematoma, and they are also sometimes a bit more resistant to being massaged away. If you're massaging a much older lump, so say you did the procedure a week or two or maybe many months ago, it could be a reaction to the dermal filler. And these lumps also do not massage away because effectively you are massaging a lump of white blood cells that have come to react to the dermal filler. There's collagen being laid down and it is not the type of lump that you can blend into the lip. There's also a very common kind of gristly lump that you get after a hematoma. So after a hematoma is healed, there's often additional scar tissue laid down. You can't see it on the outside, but when you feel it, there's a kind of rough textured type of lump, and that happens after a bruise. If you leave that, it disappears on its own within a matter of weeks. So how would you tell if it is dermal filler or the patient's actual tissue? The most common thing is the injection procedure that you went through. You consider the history of where that patient was injected, how much was injected, and then compare that with how it feels. Does it feel soft and malleable, or does it feel hard, gristly, more like a firm type of tissue? The texture of the lump and the timing of the lump are both critical ways of trying to figure out what the etiology or the actual cause of the lump is. There's another type of lump which you will often see when doing rather superficial injections. Now, superficial injections are really common. They're popular because you can get more vertical lift when the injections are closer to the connective tissue, and they're also potentially safer because you're further away from the arteries. Now, one of the downsides of this type of technique is occasionally you'll get filler that rises to the surface through that layer of connective tissue, causing small lumps on the surface of the lip. This is common with both vertical or horizontal injections, but it does need to be addressed immediately or your patient will be dissatisfied. The good news is it's easy to soften, and there are many injectors who've actually honed this skill. Julia Horn herself has actually branded it scratching. So this is what she does with a fingernail through a glove, where you just massage using the edge of the fingernail to just smooth over those little lumps. I do something similar with the pulp of my finger, but the fingernail itself is definitely a way of speeding up that process because you get the additional pressure of a slightly sharper edge. Like everything in medical aesthetics, there are a lot of different techniques that you may see when it comes to massaging lips. And how do you know which one is right? Well, I always say you need to find out what the mental model is of the person teaching you and then compare that to your own and take the best bits of what they say and come up with your own understanding. Don't switch every time you hear someone else talking about a different technique. Rather, just try and understand each point of view in detail and then make up your own mind according to what you already know. Let me take you through now how I massage lips to make sure I get the best result, the least number of lumps, and don't ruin the product that I've just placed. So if you're going to massage lips, just think about the shapes that you've been trying to create the whole time, because really the massage is about smoothing with respect to the shape that you're trying to create. So if I'm trying to create an angle on the lower lip, I usually do a massage that respects that by squeezing the shape that I want to create. Of course, there may be little irregularities on the inside of the lip, and similarly I will shape into the angle that I'm trying to create. So gentle massage. It's also very important that you feel at the same time as massage. I've noticed new people often just do the motions, but I can tell that they're not responding to what they feel. So I'm using my fingertips to feel for any irregularities and then gently increasing the pressure with respect to the shape I'm trying to create. So if you consider the vermilion border here, we're often trying to protect this. I will not massage directly onto it or in a way that would push filler upwards, but I will kind of pinch it as if I'm forming a crease that I would like to form. But I'm actually generally pushing filler slightly down and inferior rather than up into the border, because I've already placed it accurately and I don't want it to spill over or go too superior. So it's this kind of strategic shape, sculptural type massage that reflects the shapes that we're trying to create, with filler predominantly in the middle 2/3, not spilling into the white lip. That's essentially what makes a good massage. If you enjoyed that, don't forget to sign up to my Pro Injector waiting list. This movement is going to take you from wherever you are to wherever you're trying to get to as fast as possible. We've designed a whole path to make it as seamless as it possibly could be.